is a forensic psychiatrist at the Royal Healthcare Group and clinical investigator at the Institute of Mental Health Research. He's an associate professor in the Department of Psychiatry at the University of Ottawa, an adjunct professor of psychiatry in the Department of Psychiatry, the School of Medicine, Faculty of Health Sciences, Queen's University. He is a co-director at the Center for Rational and Cognitive Therapies and an associate fellow of the Albert Ellis Institute of Rational Emotive Behavior Therapy. Dr. Ahmed has testified on numerous occasions as an expert witness on mental disorders and law at courts, Consent and Capacity and Criminal Code Review Board across Canada. Please join me to welcome our very own Dr. A.J. Ahmed.
Thank you very much for that introduction. Good afternoon. Can you hear me? Can you hear me?
Yes, we can.
Thank you very much. I'm very delighted to be here, and thank you for inviting me. I'm glad to, when I received this invitation by the Council of Nigerian Professionals from Ms. Atiba, I think there was a lot of, I didn't know what to say. I didn't know what I'm going to be talking about as a psychiatrist. I think we all have had a lot about COVID. And I wondered, my first response was, what do you want me to talk about? We're all anxious, we're all stressed, and we just have to protect ourselves. So the first point of disagreement, which we later settled, was that I wasn't going to be there physically, and I apologize for not being there physically. Since March, I've only seen 12 patients in person, and I see an average of over 35 patients a week. I still see them, but I have not been in contact with person. I'm telling you this story to impact on everybody how unprecedented this has been. In my 35 years of practice, there's never been a time that I've seen less than 35 patients in any particular week by nature of my job. The other aspect of it was recently I was subpoenaed to come to go to Iqaluit out there very close to the Arctic. And I fought with the lawyer with the judge for a long time because I didn't want to go anywhere. I said I was housebound. And until the subpoena came, I wasn't going to go anywhere. And when I got there, I had to be stranded for 10 days. That just shows how unprecedented what we're dealing with. So I apologize for not being there with you, but I'll try my best. And I think I've become more an expert. I've been told to prepare a slide, so I'll try to show you the slide, share my screen with you, and I'm going to talk from the slide. But the better part of this will be the what we're going to share together as maybe question and answer if I have the opportunity to do so. So bear with me while I get this down. Host, the host has to share with me. Can you enable my screen sharing capacity, please? Just make me a co-host. We've all become, do you have, okay, thank you. You are co-hosting now. Thank you very much. Okay. I never knew I'll become so adept with this technology, but I guess with what's happening now, you have no option. Admit? Yep. All right. I should be with you. Thank you. Can you see my slides? Yeah. So what I'll be talking about is actually looking at nurturing. I title my talk "Nurturing Your Mental Health During the Pandemic." There's no doubt that this is unprecedented. I think the last time they say was in the 1800s, and the kind of thing that happened there, and we can borrow from history. But here, the magnitude of the problem we're facing today, we've never faced it before. If anybody told us when we did the crossover survey, which I never want to miss in church, if anybody told us it would be in our homes by this time for several months, everybody would say no, but nobody would believe, even if the pastor said it. But here we are today. People across the world have been experiencing higher level of stress due to this pandemic, but we're lucky to be in the time that we're now, because I wonder what those people in 1800, when they had it in 1800, I wonder what happened. If you look at some of the old homes, they didn't have any sanitation, and the amount of people that the amount of deaths that they have, but they didn't have the disadvantage of the rapidity of the spread that we have. We know that pandemic has disrupted and halted a critical service in over 93 countries in the world. For those in a study done by WHO, just looking at services, we know that in about of the 130 countries that responded, 93% of such places, services have been halted. And so for those who have mental health problems, things are even getting worse. The demand of mental health is increasing. They said that the impact is devastating in most countries of the world. And in my general practice, the kind of calls that I get frantically at the odd time of the day is also something that is indicative of how devastating this has become. 1 in 5 COVID patients, according to an American study, would develop mental health condition within 90 days. So apart from the respiratory system, the neurological system, and all the other systems of the body, but we know that a significant proportion of people, this is equivalent to the prevalence of mental health conditions. 1 in 5 Canadians, we have mental health problem before COVID, but now 1 in 5 of COVID infected patients will have similar problem. That, if you look at it, it translates to about 62,000 of the 6 million that people with previous mental health problem also are known to have more severe mental health conditions as a complication of COVID. Most common, of course, apart from this distress associated from the news bombardment, apart from the other issues that you will notice, I think the most common is anxiety disorder, which is very understandable. We also know that depression has risen higher among these individuals. That study also showed that a lot of people have insomnia, basically lack of sleep. The link between the infection itself, because we don't know much about it for now, and mental illness have been suspected to be more direct than we initially thought. Everybody at the outbreak of this COVID, it was more the uncertainty, the fear of the unknown. That was what was bugging us, right? But now it has become more, we're understanding it better. There's a definite link. We don't have all the answers. Sorry. Because I made the host, I have to admit people into the discussion. We don't have all the answers, but we do know that there's some organicity, i.e. there's some impact on the brain itself. So let's start. Coronavirus, like all the other coronaviruses, primarily targets the lungs. but it can affect the heart and it also affects the brain. So some patients with these, because of the nature of the virus, and I won't bother going to the pathology or what happened at the cellular level, so they can have meaningful discussion, actually develop stroke. Because they have swollen brain as a result of reaction to the virus within the system, they also have this confusion state, which is called delirium. They're confused, they don't know where they are. We also know that they have fatal effect on the nervous system. The degree of this impact, the neurological problem, i.e. the physical affectation or effect on the brain, vary in severity. And it depends also on individuals who have both mild, it can happen in both individuals who have mild and severe forms. In fact, individuals who do not show the the lungs are not, they're not showing, they're asymptomatic, they're not coughing, they're not having the diarrhea, they're not having the chills, they're not having the hearing impairment, actually they may have neurological symptoms. And we know that after the whole thing has subsided, at least the studies that are coming out now shows that there is residual brain damage linked to this pandemic. We also know that research among individuals who have contracted COVID show that this brain damage and neurological problem can persist way beyond when the physical symptom, the symptoms have subsided. I'm not able to move my slide. I don't know what's going on. Okay, thank you. Okay. So we're not sure what exactly happens and why individuals with coronavirus infections, why they have these mental health problems, especially those who do not have physical health problems. So we're left to say that it is the effect of the virus itself on the brain for individuals who do not have mental health problems that leads to the development of this. And the neurological symptoms that people develop are not only limited to those who have severe form of the disorder, who have been on ventilation, or who have been on life support. This diagram here that is available, of course, on the internet, shows you the kind of problem that you have among a neurological or neuropsychiatric problem that you can see among individuals who have coronavirus. You can have inflammation of the brain matter. You can have inflammation of the covering of the brain. You can have muscular problem, i.e. problem with your muscles, but not originating from the muscle itself, but originating from the nerves that control the muscle. So you have people with abnormal movement. You can have psychiatric disorder, and we're going to be spending some time on that. And then you can have neurodegenerative disorder. There's a lot of hypothesis out there that the long-term effect in these individuals may actually lead to neurodegeneration. So we would not be surprised if you start seeing people who are presenting with dementia as time goes on. You can lose your smell. You can start having other cerebrovascular accidents. That's what leads to the stroke. And then you can have As a result of release of toxins, you may have toxic encephalopathies, metabolic disorders that may affect even your glucose, insulin control, diabetes, and other systemic inflammation. So that's a broad area that it covers. What are the long-term effects? This is where actually psychiatry becomes a problem here. Because generally speaking, what you tend to see is that individuals, the serious long-term symptoms among COVID-infected patients can be divided into three main groups. You have those ones that are essentially manifested a residue of the acute phase: tiredness, shortness of breath, coughing, joint pain, chest pain. Then you can move into another stage where people will start describing what colloquially has been described as brain fog. It's just the oomph in you has got up and gone. Before you even get into full-blown depression, you just discovered that you're not as sharp. Then you can go into depression, the muscle pain increase. People can then start complaining of headaches. There may still be intermittent fever, and then there's increased heart rate. Then you move into the third group of symptoms, which may be a problem with the cardiovascular system. Basically, it's affecting the muscles of the heart, the respiratory abnormalities are a problem, failures, and so on. So majority of people that will die in acute phase die of this kind of complication. Then we're getting to the neurological problem where you lose your smell, you lose your taste, your sleep becomes a problem, concentration becomes a problem, and then, of course, later on, you may start having people having depression, anxiety, change in mood, and substance use in the early phases as people try to cope. So these are the kind of long-term effects that have been reported. Without going into the details about what happens, I think it will be better for us to spend more time on what we actually do during this COVID. One of the biggest problems in the initial phase, if you all remember in March, April, every one of us was so anxious, everything was locked down. One of the biggest problems is information overload. Yes, it's good to keep informed, but unfortunately, some of the information that is out there, you got to be very careful. You got to listen to advice and recommendation from reputable source nationally and from your local authority, Ottawa, Health Canada. I mean, we have a lot of information sources here that you can rely on. I won't rely on WhatsApp. I won't rely on those information that comes in all the time because it creates more problem for you. Follow trusted news channel. If you've been listening to the politics in the States, maybe if you're like me, you follow CNN, you won't follow Fox, but at some stage you follow both. But in this case, you've got to follow the trusted channel. One other area, and this is very important, is actually to keep routine. This is the way to keep you healthy. You keep your daily routine. If you don't have routine before, develop one because it's very important. I tell my patient, I say, you know what, I want you to get up. Even though you're working from home, I want you to get up, get dressed, and go to work. So you leave the bed, leave your bedroom, leave your sitting room, go to a designated area where you can work from. And one thing that is important to say here is that I think a lot of people actually, their jobs have doubled. You have a parent who works in an office, go to daycare. Now they're doing the two. You're the daycare You're the childminder. In addition to being the childminder, you're also the psychiatrist or the nurse or the pastor. So please get up at similar time, keep your personal hygiene. Don't stay in your PJ all day and say nobody knows, nobody will see me anyway. Eat healthy at regular time, exercise regularly, allocate time for when you work and the time you rest. Very important. Make time doing things that you enjoy. That's very important as well. Minimize your news feed. As I indicated before, there's a lot of garbage, especially on social media. You've got to be very careful. So minimize how much you watch, even the good one. Some people have said, listen to news on just once a day. Other people say just listen twice a day, and that should be sufficient. It's not a question of you checking what is on the news again, what is the latest statistics, because you just get yourself into more frenzy that is unnecessary. It is important to keep in contact. So although we're isolating, I think it should be it's social, it's physical distance, but social distancing can come with more problem. It's physical distancing. So use all the channels to get in touch with people. We know that there's, because of the isolation, because of the stress, that alcohol and drug use has increased. Certainly in my population, I've noticed that. So you got to watch it. And if you don't drink, hey, don't start. Don't start drinking, look for other ways of coping. Avoid the use of alcohol to deal with your fears, anxiety, boredom, and social isolation. So instead of that, maybe you pray some more. That may help you, but rather than getting yourself into this big trouble. I certainly, my screen time has increased in my job because most of my patients that I see now, I just do this, is the screen time. You got to monitor the screen time. And I alternate a lot with telephone. And in fact, I tell my clients that, you know what, we're meeting here. Maybe the next time I see you, we use the telephone. If you want to see me, then, and the patient do understand that. So in whatever you do, please monitor and limit your screen time. One of the ways people have coped is playing games, and this is very important, particularly for the younger ones. Be sure to keep a balance between your offline activities and the video game. I have individuals who they'll sleep for probably 3 hours, 4 hours because they're playing video games, and that's becoming something that is a major problem. Use social media to promote positive and hopeful news. That's the advice. Because a lot of people, especially if you're the news, I remember reading social media. I'm calling from my office in Byhaven, and the kind of report I read on social media about Byhaven was that, hey, everybody, every next person is infected. It was so frightening. You got to be careful about what you put there and what you read. Help others. That's very helpful. You know that what you give out, you're probably going to, the audience is familiar with this concept of helping others, so I don't have to spend time on that. As indicated in what was said in the introduction, your health workers, they're doing a lot of work. Do appreciate them. And it goes beyond health workers. Certainly the person, the cashier, the person, even my frequent point of call is Starbucks. I pay my homage there every morning, and I say thank you to them. A little bit of increased tip is actually, it makes their day. Make somebody happy while this is going on, because we're all stressed. Let's now move to specific area that may be also of help. Parenting through COVID. There's no doubt about it that mothers, fathers, grandparents are going through a hard time with kids not going to school, some going to school partially. Should I homeschool? Should I do a hybrid? Those questions have been answered. There's a lot of information out there, but there's certain things that are important for you to maintain during this unprecedented period. One is be familiar, maintain familiar routine at home. And if you don't have routine, create new ones to add to whatever you had, or create new ones entirely and make it fun. Discuss the news about coronavirus with your kids in an honest manner. I'll be honest with you, we don't know a lot of things. We know some things, and the information we had in March, the one we had in April, and now what we have is quite different. You had a president that said you could inject bleach into yourself. That's what he said. It came from somebody like that, and you got to be able to educate the patient. I mean, your children. And it's not necessarily the younger ones, even the adults. I have adult children, and when we talk, they bring all this information. You got to check it out and ensure that they know what's going on. Support your children at home. My adult children are at home now. Yes, they probably don't need my support as much, but in whatever way I can support them, we still do things together. Art is one thing that we love to do at home. My son is very much interested in art. I encourage him to do so, created a studio for him. Whilst he's not in university, he's able to do that at home. Help children find possible way of expressing themselves. There's fear, and it's good to acknowledge the fear, the sadness that may be associated. And one of the things that tends to happen with children is actually if you engage them in play and draw and express themselves that way, it's probably easier. Kids miss their friends, and a way of organizing for them to meet either via telephone and online is important. And in fact, one of the things that, on Doctors Radio and some other researchers actually advise it, you can help them, now the weather has changed, but you can help them have, they can have get-togethers, parties with social distancing and the mask that they need to use, have them use the mask and be able to meet while they're keeping social distancing, reducing the number. Make sure that your children have time away from screen. That's very important. And you can convert that to other activities. I love to cook. I never knew that I can cook as much. So now most Nigerian delicacies, and I name some other things, I call it, I just give it a name, and my daughter and I, we have fun with it, just trying to break that boredom. Try and ensure that your children do not spend significant more time than usual on video games. Get them distracted and get them to engage in other activities. You can get them to read, choose book together that you can read as a family. What about the elderly or the older people? We know, and if you look at the statistics among individuals who succumb to the effect of COVID, it's usually the elderly with compromised physical health. And those are the individuals too that at least paying particular attention to what they need to do. Keeping regular contact with loved ones is very important. That I happen to have a proportion of musicians in my general practice here, and I was surprised. Two of them at different time came and they were telling me how they organize a cappella, and they all say by there, and somebody's singing in one home, and they've continued to maintain that contact, and which was very innovative, using email and other video facility. Keep regular routine, schedule as much as possible, routine, home-based physical exercise is also important. A lot of people couldn't go to gym, elderly people couldn't go to gym, then and there's some of these are available free of charge that you don't have to pay for it. These virtual gyms. YouTube has a lot of virtual gym exercises that people can engage in. I keep referring to my daughter. She has a program called Beach Body. So Tommy is doing the beach body thing. Daddy is listening and say, "Oh, that's cool." You make fun out of it. I think that's very helpful. Find out, sorry, find out how to get practical help if needed. Having your numbers available, what you need to do, and having everything available is very important. It is also important that you have your medications if you're on regular medication to keep them handy. Family members, friends, and neighbors, ask them for support. Don't be shy. Some people have that ability to provide necessary support. What about individuals who have pre-existing mental health problem, depression, anxiety? It doesn't have to be the major mental disorder, because we know that if you have a pre-existing mental health problem, there's increased symptom. People have increased symptoms these days. There may be exacerbation of pre-existing and social isolation further compromises that. So make sure that you continue to take your medication, restock, and how to restock medication. There was a time at the beginning of COVID that certain types of medication were not available, and it was pretty. It created anxiety even healthcare providers at that time. But we were lucky; it didn't last too long. We were able to have substitute for some of these patients. Continue to see your mental health specialist, therapist. Most people are adept now with video counseling and so on and so on. Keep in touch with people who care about you. Keep in touch, and the people that you care about, that's the other way you can reciprocate too. There may be, as we've indicated, there's increased stress, fear, anxiety, social isolation, and therefore people have this tendency to want to cope. And the elderly people or the older people are more likely to want to cope. I've had people that come, the group of medication that is dependency forming, they were taking more of those medication because of the stress. I think helping people to be aware that there's a problem. There are other ways we can deal with this so that we ensure that you don't have problem with medication at the end of the day. Check with your therapist or healthcare providers about the ways of continuing to receive whatever kind of treatment. I had indicated to you, and this is just a slide to show how much problem we've had with mental health services across the world. This is a WHO study showing how disruption in services have been. We're having numbers around 60 to 70% of disruption. We're having people not being able to receive their therapy. We're having people really who are vulnerable in terms of harming themselves. We're having people not being able to have other medication that will stop them from going back to substance abuse. These are realities, the things, there's a restriction, and we need to find a way of adjusting. This slide is available. It's just a summary of what I've said so far in terms of things you can do to help cope with this unprecedented period. Stress is very common. And how do you do it? There's a lot of distraction. I'm finding things to do at home, and the internet has a lot of information if you can sieve through it. There's some beware of the reputable sources, and those are the ones you got to concentrate on in order to address this. Finally, there's no doubt about it that there's a tendency to discriminate. So you got to be aware of both overt and covert discrimination within you and from what people will give to you. Typical example is you go out there in the gas station, you forgot to put on your mask. You're likely to have these individuals who, and we've had reported cases, people are talking to the other person and say, "What the hell do you think you're doing?" Classical quote. And some people use flowery language. You got to be very careful as well that is motivated by fear, which is a normal reaction. So as a receiver of such hostility, beware. As a giver of that such hostility, beware. So if you keep this principle, I think it will help us so that you don't respond in kind. The person that says some hurtful words to you, it's not because it may be generated by fear. And even if they had other sort of notion, I think the fear has accentuated their pre-morbid state, pre-COVID way of responding. So anxiety can lead to anger and hurtful response. So please beware of that. The other thing is that if an individual has been confirmed or has had COVID infection, we're not to start discriminating. It happens in so many other, from leprosy to AIDS or whatever. There's always this tendency to want to discriminate, to want to avoid. Yes, why you keep social distancing, why you ensure you protect yourself, be empathic in dealing with them. Do not discriminate against health workers. Yes, they're more vulnerable, they're there, they're in the front line, they may bring things home. You got to be very careful about that. Yes, certain part of the world or certain group of individuals have, COVID started somewhere and it's gone to many other countries and it's gone from one country to the other. So beware of this discrimination too, to specific group. It's not attributed to any group. So beware of your response to such individuals. I'd like to end by saying that these two will end, and until then, just keep well and be safe. I thank you very much. I'd like to, I'll take as any question that you may have. Thank you.